Hey everyone, it's Lindsay here at Oasis Recovery Center. Today we have Renee here. She is our IOP director. She's going to be telling us a little bit about addiction and mental health and what we do here at Oasis to treat the corresponding disorders.
Hi everyone, so I'm Renee. I want to tell you a little bit about the co-occurring disorders of mental health and substance use. So research has shown that mental health and substance use are so intimately combined. Around 50% of people with a substance use disorder experience a mental health challenge. And they have been doing new studies about youth, and it's about 60 or 70% of young adults with a substance use disorder that have a mental illness. So it's really important now that we as treatment centers and therapists begin to treat both. The old school way of thinking kind of told us that we need to wait to treat the depression, anxiety until the person stops drinking, for example. And now what we know is that we need to treat them both at the same time for the best results in someone's recovery. So there's something called, which you all may have heard, it's called the self-medication model of addiction. So it kind of comes with the philosophy that individuals end up addicted to a substance because of an underlying mental health challenge. So for example, if someone struggles with severe anxiety, they would end up addicted to some sort of downer, like Xanax or alcohol, to treat the underlying depression. So although this doesn't apply to everyone with an addiction or substance use disorder, it does apply to 50% or more of individuals. So the unfortunate thing, though, about self-medicating is that we know mind-altering substances actually creates more challenges for mental health than it does help. So what we do here at Oasis is a couple things. So a huge underlying part of mental health often is trauma. Over 95% of women with an addiction have experienced some form of trauma. That doesn't mean that they have the diagnosis of PTSD, but it means that some time in their life they've experienced a trauma. So something that we do at Oasis is we really try to be trauma sensitive. The best possible treatment for someone with both a mental health disorder, so some common ones are borderline personality disorder, bipolar disorder, generalized anxiety disorder, major depressive disorder, and PTSD. Those are some of the main ones that we see all the time, co-occurring with a substance use disorder. So we try to be as trauma sensitive here as possible, and the best way to treat both of those disorders together is an integrated approach. So I have personally never worked at a place that tries to take such an integrated approach, including things like mindfulness, evidence-based approaches such as mindfulness, CBT, which is cognitive behavioral therapy. That's actually the most researched way to treat these co-occurring disorders. And I know I'm sounding like a nerd. I hope some of this is getting across. So we basically implement a lot of evidence-based practices in order that has been proven to treat both of these disorders. And it's really, really important that the person with the co-occurring disorder and their therapist work on the connection between the two. Because if someone enters recovery and they just focus on getting clean and sober, and then they become extremely depressed, can't leave their bed, stop showering, it makes it extremely hard to go to meetings, to call our sponsor, do the things we need to do for our addiction. So if we ignore that, which has been the tradition in the past with substance use, is like just deal with getting someone off of drugs and alcohol, and then their mental health comes up with a vengeance. It's you can think of it like imagery, so whack-a-mole. We hit down the substance use, and then the mental health pops up. The eating disorder is a huge one for women in recovery, huge. So that'll come up. Gambling disorder, porn and sex addiction will come up. Those are ones that we often don't talk about because it makes people uncomfortable, but those are ones that definitely come up. And so it's really important that we begin to focus on healing ourselves as a whole and not just fragments of the way our addiction is presenting and our mental health is presenting. And so here as a staff, we're pretty well educated with not only addiction, but also mental health. We have psychiatrists here that our clients can see, which is super helpful in moving towards the integrated care of medicine and treatment to allow our folks to kind of get leveled off with medication to help with some of that. And as a staff, we kind of take care of our own health holistically, so we're able to really be there for spiritually, emotionally our clients. So I don't want to hold you for too long. I know this has probably been a few minutes already, but that's just some of what we do here. This is such a big and important topic, and I know that so many of us can relate to this co-occurring disorder, and it's increasing people's awareness of both. So it's really important to treat both, even if you are in Oasis or if you aren't in Oasis, please find some sort of integrated treatment to be able to have a life that you feel is worth living. Thank you.
All right. Thank you, Renee. Until next time, I hope everyone has a good day. Thanks.